President Barack Obama signs the new health care reform bill into law today. It should provide health coverage to more than 30 million Americans who are currently uninsured. News 10's Dan Klein is live in the studio and reports there's a lot of changes for people who already have insurance. Dan?
That's right, Mark. The bill will have some major positive changes for those who are already insured. It will also come with some added costs. Leonard Tommy says he's lucky to be alive. 15 years ago, he was diagnosed with thyroid cancer. 6 months after that, his insurance company dropped him, saying he had pre-existing conditions.
It was a bad situation all around, and when you look at your doctor who's saving your life, and he knows, and he just disregards, that's compassion.
Soon, Tommy's story will be impossible to duplicate. In 6 months, insurance companies will be unable to deny coverage from people when they get sick. They will not be able to deny coverage to children who have health problems. They also cannot cap the amount of money they spend over the lifetime of a plan. It also requires insurers to allow dependent children under the age of 26 to be allowed coverage on their parents' plans. For those on Medicare, the gap in prescription drug coverage will start to be filled in. But there's also some negatives. Starting in 2013, persons making $200,000 a year or couples making $250,000 will pay more taxes to Medicare, and additional income like dividends and interest will also be taxed. And starting in 2018, high-end insurance plans will be taxed at 40%. All told, Tommy supports today's reform changes, but still remains cautious.
Overall, I do. I don't know about the expense of it, and I don't know about the bureaucracy.
So in the end, what does this mean? Well, if you get your insurance through a larger employer, there should be few changes. Congress estimates premiums will rise about 10% extra for individual policies with the new reform, but many may end up paying less because of subsidies. Mark, back to you.
Thank you, Dan. While coverage will be expanded, many folks wonder who will pay for this. In a statement released to News 10 today, Anthem Insurance, Indiana's largest insurer, expressed satisfaction with more comprehensive coverage, but the company is also concerned with the long-term cost. The statement read in part, "We are pleased to see that more Americans will now have access to coverage. At the same time, affordability is more important than ever before, and we remain concerned the bill that was passed does not address long-term cost containment measures that will make the system sustainable." To let us know your thoughts about the health care bill, head to our Facebook page and leave your comments.